Hello, my name is Faye Johnstone, and I have the pleasure of hosting us this evening at Spectrum's Community Forum on the Trans Wellness and Suicide Prevention Toolkit, developed in partnership with Wisdom to Action. Before we begin, I would like to acknowledge that we are joining today, many of us as settlers on this land, and joining virtually. So many of us may be spread across different nations and treaty territory from coast to coast to coast. Spectrum is indeed situated on the Haldimand Tract, which is the traditional territory of the Haudenosaunee and the Mississauga and Anishinaabe nations. We recognize that this nation, this land, this community is home to many peoples, including many Indigenous folks from diverse nations. And we also recognize that the Chinootan peoples, or what have become known as the neutral nations, are a people who have been entirely eliminated by the colonization that has taken place upon this land. I myself am joining from unceded, unsurrendered Algonquin territory, which is colonially known as Ottawa. Throughout our time together today, I would encourage everyone in attendance, particularly again, settlers in this space, to acknowledge and reflect upon the ways in which gender, sexuality, class, ability, and other factors have often been used as part of colonization, and indeed as tools of a colonial process. When we talk about anti-oppression, when we talk about decolonization, it's important to recognize how homophobia and transphobia have largely been imported to this land as part of the colonial process in a way that continued and continues violence against Indigenous folks, and particularly violence against indigiqueer or two-spirit LGBTQ people on whose land many of us indeed reside. In terms of our agenda for today, we are joining from 5 to 7 Eastern. We're going to start with some welcome and introductions, explore a bit of the background and context for this toolkit, review the development process, including key lessons and learnings in terms of what we heard from community members, introduce the toolkit itself, which is the exciting part, through a highlight of key sections and feature tools and resources that we think will be of interest and excitement to you. Finally, at the end, we will pause to encourage you to jump into the conversation and share your thoughts, your reflections, and any recommendations for how we move forward to tackle this very important issue that impacts so many people in our communities. Now, in terms of objectives, our first objective is providing an overview of the engagement findings and project objectives. So what did we actually hear? What were the processes that we undertook to connect with community members? And how did we take what we heard from them to inform the development of this toolkit? As mentioned, we'll then provide a high-level walkthrough and review of the toolkit content and structure. And then once again, we'll end with some open discussion for reflections and thoughts. Now, in terms of our audience or our hosts for today, as I mentioned, I have the pleasure of hosting this evening. My name is Faye Johnstone. I use she and or they pronouns, and I'm the executive director here at Wisdom to Action. I'm also joined today by my colleagues, Rose Clancy and Alyssa Frampton. I believe if the recording is working now, they can probably turn on their cameras and you may indeed be able to see their faces for a moment. So welcome, Melissa, or sorry, Bob. Welcome, Alyssa, and welcome, Rose. Thank you for joining us tonight. In terms of other folks, I'm going to pause for a moment and invite the Spectrum team to introduce themselves.
Certainly. I'm Melissa Page Kennedy. I am the Director of Trans Services at Spectrum, and my pronouns are she and her.
Awesome. And now, Christy, would you like to jump on in?
Hi, hello everyone. I'm Christy. My pronouns are she, her. Right now I'm the outgoing acting executive director for Spectrum, and I'm really thankful and excited to be a part of this project.
Awesome, thanks, Christy. And Scott, over to you.
Hi, Scott Williams. My pronouns are he and him, and I am a project coordinator at Spectrum.
Awesome, thank you so much. And I'm gonna share my screen again so you can see my lovely slide deck. So over the course of the last few months, we've worked closely with Spectrum and our own team here at Wisdom to Action to execute this project, more of which you'll hear about soon. So in terms of Spectrum, I'm actually going to pass it back to Melissa. Melissa, would you like to turn your camera back on and say a little bit about Spectrum?
Can you see me and hear me?
Yes, indeed.
All right. So In short, Spectrum is an organization that serves and affirms and supports the well-being of the 2S LGBTQ individuals within the Waterloo region and the broader community through peer support, community partnerships, education, and training resources and events. So we're the first rainbow community space within the Waterloo region, which is an inclusive community for all 2S LGBTQ plus individuals are welcome, celebrated, and supported as their authentic self.
Awesome. And I believe, Melissa, you wanted to speak a little bit to the context and background on the project.
Absolutely, I will do that. Just give me a second here, pull up my notes.
It's always the fun of a virtual world.
It is. All right. In February 2021, we applied through the Canadian Women's Foundation for a Safer and Stronger grant. This is a funding stream focused on addressing gender-based violence, and Spectrum was able to qualify under the category of addressing violence or harm issues related to two-spirit, trans, and non-binary peoples. In our grant application, we noted that based on documents like the Trans Pulse study, the Outlook Symposium report, as well as anecdotal information from our drop-in groups, there was evidence that pre-COVID, a large portion of transgender identifying folks in Waterloo region had not come out of the closet or found that many people in their life were unsupported or worse, abusive. This in turn subjected these folks to high levels of mental health stress. We recognized that the situation was being aggravated by the isolation due to the COVID-19 health emergency and resulting close contact of individuals in unsupportive or abusive environments where they had become a captive audience. This then was the genesis for our project application, for which we have two primary objectives. First, we wanted to develop, publish, and analyze an anonymous community survey asking, among many other things, how COVID-19 isolation was affecting their mental and physical health. From this group of respondents, we also wanted to interview a select few to do a deeper dive on mental health challenges. The information collected would be used to shape the toolkit we plan to create. The second part of this project was to develop a toolkit focused on mental health promotion and suicide prevention to be used by the transgender identifying folks or the people in crisis and mental health and medical health professionals and transgender allies or people who support those in crisis. We felt such information organized into a toolkit would be very useful to the community during and after the public health emergency. We used the Herd Alliance Mental Health Toolkit developed by the California school system for high school students as a template for our project. On March 30th, 2021, we were notified as follows, quote, "On behalf of the Canadian Women's Foundation, we are pleased to confirm that a grant of $71,250 is being awarded to Spectrum Waterloo Region's Rainbow Community Space under the Safer and Stronger Grants program through funds provided by the Department of Women and Gender Equality, WAGE. We understand that we will be using this grant for COVID-19 related programming to increase your organization's capacity to deal with an influx of increased gender-based violence during the COVID-19 pandemic and support your ability to help address, prevent, and reduce gender-based violence. We developed and published a request for proposal, and after reviewing several excellent submissions on May 21st, 2021, we awarded the contract to Wisdom to Action. Wisdom to Action is a national social enterprise and consulting firm specializing in community engagement, creative facilitation, research and evaluation, knowledge mobilization, and EDI. We held our kickoff meeting on May 25th, 2021. The project is now nearing completion, and we are pleased and excited to announce that we will soon have a toolkit in the form of a printed booklet for distribution to the community. We will also post a PDF of the toolkit on our website. I will now hand this presentation back over to Wisdom to Action and to you, Faye, to talk about the project results in further detail.
Awesome. Thank you so much, Melissa. And on behalf of our team here at Wisdom to Action, I want to say it has been an honor to undertake this work with your team, particularly as a business that thrives and lives and breathes into SLGBTQ inclusion in every way that we can. It's been an exciting piece of work that for us has been deeply meaningful in really powerful ways, and is something that we are excited to see made available to the Waterloo region, and an example and tool that we see great value in for communities and trans folks and friends and family and colleagues and providers who work with trans folks all across this country and indeed around the world. In starting this project, we realized there is no example to build off. I don't believe there is a trans suicide prevention toolkit and mental health promotion toolkit that has been developed to date. And so we see this as a unique and incredible opportunity. And I would also say that we are grateful and thankful to the Canadian Women's Foundation for funding this, and ultimately to Women and Gender Equality Canada and the Government of Canada for helping make this important work happen, and for supporting a LGBTQ community organization such as. In terms of Wisdom to Action, I'll briefly give a bit of context and background on who we are. So we were founded in 2011, and in 2018, we reincorporated as a consulting firm with a social enterprise commitment focused on helping organizations, government agencies, and community groups facilitate change and strengthen communities. We do that through our deep commitment to anti-oppression, to valuing community leadership, and leveraging evidence to put into practice solutions that work for all kinds of communities. In terms of what we do in practice, we live in the world of 2S LGBTQ inclusion and supporting 2S LGBTQ community organizations. We also provide knowledge mobilization and resource development services to a range of clients across the nonprofit and beyond the nonprofit sector. And we thrive in the world of community and youth engagement. So working with communities and working with young folks to bring their perspectives, their brilliance, their resilience to the fore, and work with them not only in consultation, but as much as we can in co-creation. Finally, we are very passionate about research and evaluation and learning from our work and ensuring that the work that we do is informed by evidence. You can learn more about us at www.wisdomtoaction.org. Now, Melissa already did a number of thank yous, but I do want to come back to another thank you to the Canadian Women's Foundation and to Women and Gender Equality Canada for their support of this initiative. I also want to thank all of the folks who completed the survey, who weighed in with their thoughts on what this toolkit should look like, what content needed to be captured within it, and those who participated in key informant interviews and helped us zero in on more tangible and deeper recommendations that could be informing this work. Their perspectives, their brilliance, their wisdom is something that we can only hope we are effectively putting into action. And for all of that, we are deeply, deeply thankful. In terms of why this toolkit was created, I think you heard from Melissa about the issues and needs in the Waterloo region. We also know that by and large, trans people are disproportionately impacted and struggling with both their mental health and well-being and suicidality. Despite that, we know that there aren't many resources that speak to trans people's needs and contexts, and that many service providers, families, and friends of trans people struggle to find tools that can help them better support their trans loved ones or clients. And so that formed the basis of this toolkit, to attempt to address that gap in resources and in knowledge and in research by bringing together, again, the expertise of community members, service providers, family members, and the research itself. So how did we do that? How did we consult with folks? How did we bring folks into this conversation? Alongside Spectrum, we developed a survey for community members, touching on key stakeholder groups. First and foremost, of course, recognizing that trans folks are the best experts in our own experiences, and often, I would say always, best positioned to identify our needs and help respond to those needs. We consulted trans and gender diverse folks in the region. We also connected with family members and parents, as well as service providers and other key stakeholders, friends, colleagues, folks who wanted to share their thoughts and help ensure that this toolkit took a shape that would work for them in their unique context. We also conducted key informant interviews with a number of folks to zero in a bit deeper From our experience, a conversation always brings new knowledge and new practices to the fore. And then we engage in a review of the literature to review what do we know about suicide more generally, but particularly what do we know about suicide and mental health in trans communities, around issues like eating disorders and self-harm. What do we know about interventions and resources that can support folks to better manage their own well-being, that can help other individuals who may not be trans learn how to support trans people. And we brought all of that together in a deep analysis that guided our initial skeleton structure for this toolkit and has informed our work developing the toolkit over the last few months. Our commitment in this project was to create a toolkit that was applicable to a wide range of stakeholders, but also that was deeply responsive to the unique needs in Waterloo region, while still being pertinent to a broader audience. A toolkit like this is complicated. Suicide prevention and mental health promotion are big topics. And many issues that one might not think are immediately connected to suicide prevention and wellness promotion were indeed identified as very important to trans folks in the Waterloo region. Topics like transness and religion, like addressing and preventing street harassment of trans people, issues like faith came up time and again. And so our commitment throughout this toolkit was to factor that in, to develop resources that responded to localized needs experienced by trans folks and other stakeholders in Waterloo. Now I'm going to take folks through a high-level review of some of the feedback and topics that were identified through our consultation. And of course, there will be more opportunities to share those learnings and lessons in the near future, particularly when you review the soon-to-be launched toolkit. In terms of topics that we identified from trans folks and gender diverse folks themselves, we heard a ton about the need for self-care and wellness resources, for resources on how to cope and maintain your own well-being while facing issues like transphobia on a daily basis, while struggling with issues like street harassment, gender-based violence, misgendering, or naming of trans people, and a long list of other examples that were identified through our survey and key information. We heard about the issue or need for safety planning to help folks better know what to do in a crisis and have tools and strategies ready to equip them if they find themselves in crisis. We heard about self-advocacy in healthcare and social services, recognizing that those institutions still have a ways to go to build their capacity and better support trans folks. We also heard about harm reduction and survival, helping folks keep themselves going when the world is hurting and when they themselves are hurting too. We heard about combating isolation, and something that I hope we found great joy in and of itself was finding that topic of finding joy and resilience. Not only speaking to the negative in a world that is already very negative, but creating tools to help trans folks take pride, strength, resilience, and beauty from their identities. To take strength from the communities they're connected to and the proud histories of those communities. We also heard from service providers and family and friends. Service providers spoke to the need for more resources on the core concepts and practices of trans inclusion, understanding concepts like transition, which many of us have some concept around, but many folks don't have a deep understanding of what that means and looks like to different people, either transition medical, social, or take some other form. We heard about the need for unique resources to support non-binary people who continue to struggle with a system that is often encouraging us to be one thing or the other instead of somewhere in between or well beyond. We heard about organizations that needed tools to actually support culture change and guide them on a longer term journey to build truly trans and gender diverse inclusive environments. And of course, we heard about the need for resources to better know what resources are available, both on trans and gender diverse related issues, but also more broadly in terms of issues like addiction and substance use, GBV, gender-based violence, coping with intimate partner violence, etc. And of course, as is often the need, myth busting, debunking some of the stereotypes and stigmatizing concepts that are still often held that perpetuate harm against trans people and result in barriers to care. When it came to families and friends, we heard about the need for resources for schools to help them make life safer for trans people. Again, education on trans identity and supporting trans family members. So not just, what is trans identity, but how do I actually support my young person who just came out, or my friend or family member who is just exploring their honest and authentic self. We also heard the need for resources to support parents to care for themselves, and to understand how to process some of the things that are changing in their lives, while still, of course, centering the needs, safety, and well-being of their trans and diverse children and youth. Now, in terms of the toolkit itself, these are the general sections. And so for context here, the toolkit is not yet live, but indeed soon will be. And you will indeed see a link posted, and it will be printed and shared on the Spectrum website once it is indeed in its final product. In terms of the toolkit, we identified a series of very important topics that needed to be addressed within it. First and foremost, the introduction section, which touches on, largely it's thanking and recognizing the folks who contributed to this work and touching on the process for development you've now seen a little bit about. And then understanding trans and gender diverse communities. So what are the histories of these communities? What do these words mean? And what are some of the experiences that are common to trans people? Understanding mental health and suicide prevention, or suicide and well-being in trans communities. Exploring what do we know about prevalence, about protective factors and risk factors, about interventions. What do we know about, again, issues like self-harm or substance use that are connected to our overall mental health and well-being. We then began developing the concrete tools and resources. That began with general concepts and practices for understanding and supporting trans people. These touched on, again, topics like transition, like advocacy and self-advocacy, concepts like non-binary identity and non-binary inclusion. And then we focused specifically on preventing suicide and promoting trans wellness. This included resources for trans folks themselves, resources for parents and caregivers to support their trans children, resources for friends and colleagues, and finally, resources for service providers. Now, this is a high-level overview, but in the next few slides, we'll get a little bit more in-depth. When it came to understanding trans and gender diverse communities, we identified 5 key topics. The first of which was introducing, indeed, trans folks. What does it mean to be trans? What are some common words and concepts that we can put in place to make sure when we say the word trans, we all have some idea of what we're talking about? And also caveating statistics. There's a lot of research out there, but there's also not a lot that speaks to trans identity or experience or needs. And so we sought to better understand the broader literature around suicide prevention and suicidality, and utilize some of those opportunities to inform what life might look like for trans people. We also spoke through minority stress, which is a concept and a theory used to describe the impact on your mental health, your stress levels, your well-being, living in institutions, structures, and a social context that is often transphobic in nature, as well as racist and sexist and homophobic and classist, and exploring what that impact has on those communities and how that creates and perpetuates a greater prevalence of mental health issues and higher likelihood of struggling with suicide. Throughout all of this work, there is a tendency in this work to paint communities with a simple brush, to homogenize different identities and to fail to look at the intersections. And so we focused in this section in particular into intersectionality, which we did indeed strive to weave throughout the toolkit. In this section, we spoke to the unique experiences or disproportionate impact for folks who exist at intersections of identity. Folks who don't just experience one form of oppression or another, but the compounded impact of multiple. And then we explored the health effects of marginalization, getting in on what we know about how marginalization and living as a person in a context where oppressive structures exist impact your health and well-being in broader terms. When it came to understanding mental health and suicide in trans communities, we focused in on those higher level statistics and the higher risk population. So even within trans communities, we know that different folks have a higher risk because of broader factors. Often includes Black, Indigenous, and racialized trans people. That includes poor trans folks. Particularly, that includes trans folks who don't have supportive and affirming parents. We also reviewed what we know about suicide in trans communities, as well as risk and protective factors. So what are the things that increase risk? So what are the broader social factors that increase risk? And then what are the things that we can do on a community level to protect folks, to reduce the risk, to reduce the odds of poor mental health? Given the importance of the following three topics, we also explored them in particular. We know that self-harm and self-injury are concerns for many trans people. We also know that eating disorders impact many trans folks, and particularly trans folks who are experiencing gender dysphoria, whose relationship with their bodies may be complicated, that can indeed be compounded and connected to the development or experience of eating disorders. And then we explored substance use and the impact of and prevalence of substance use and how substance use impacts trans folks' mental health and well-being. And then we shifted again to some of those general concepts and practices. Understanding transition, so talking through what transition is and very much what transition isn't. So pushing back against this notion that there is one way to be trans, one way to experience a transition, talking through the different kinds of transition, what they might mean to different people. The legal transition, changing your name and pronouns in a legal context. Social transition, so changing your presentation and how you engage in the world. And medical transition, so accessing things like hormones and other medical interventions that can help you feel more in alignment with the gender you know yourself to be. We zeroed in on resources for supporting non-binary people and embracing an approach to gender identity that allows for a universe of possibilities, while also identifying some of the common missteps and barriers to supporting non-binary people and enabling them equal access and inclusive access to spaces and services. Pronouns are a central tenet of trans inclusive practice, and so we explained and explored what those are and recommend and identified practices that individuals can put in place to ensure that pronouns are more often respected and referred to appropriately, and how individuals who do make mistakes, because indeed we all make mistakes, can apologize and move on from those moments so that they are indeed engaging in a way that is supportive of trans. Recognizing that there are many stereotypes and that language is evolving every decade and every generation, we zeroed in on some of the harmful language that we recommend folks avoid, while of course always affirming that individual trans people are the best experts in their own experiences and identities, and are best positioned to positioned to inform and use whatever words they so desire to describe their own identities as the best experts in their own experiences. And so we walked through some of the nuances on that front, but zeroed in specifically on some of the language that is generally best avoided, that may be dated, or that may not be as inclusive as more contemporary options or alternatives are. We spoke about addressing mistakes, so misgendering, dead naming, and other microaggressions. What to do when you make a mistake, when you say something you maybe shouldn't have, and how not to make a bigger deal out of it than it needs to be. A lot of the time when folks misgender trans folks, it can be addressed through a simple correction, an apology, and a commitment to do better next time. So we talked through some of the processes and recommendations on that front. And then recognizing that supporting trans people can't be limited to individual reflection, that it needs to be grounded in practice and in a commitment to solidarity. We developed a tool or a resource on how allies, so cisgender people who are not trans, can work in solidarity with trans communities on local levels in their individual relationships, but also on broader levels to address structural and systemic barriers that perpetuate violence and discrimination, and therefore poor health outcomes in trans communities. Much of the toolkit is dedicated to resources for trans folks themselves, recognizing that, again, we are often in positions where we have to be the chief architect of our own well-being, and recognizing that many trans folks are often new to their identities, just coming out, and striving to cope in a very complicated world. First and foremost, we wanted to ground this section in a alternative narrative, one that isn't focused on poor health and sad statistics, but that embraces and recognizes the resilience, the beauty, the strength of trans people in our communities, and providing some recommendations on how individual trans people can keep that conversation centered. can recognize their own value and recognize that the simple act of existing and surviving as a trans person gives us a degree of resilience that few others can quantify or understand. We also spoke to harm reduction strategies for surviving in a world that's difficult. So if everything is difficult, how can we find harm reduction strategies so that our coping mechanisms are as healthy as they can be? How can we establish clear boundaries with family or friends that may not be inclusive of our full identity? And what are the steps that we can take to maintain and control some of the behaviors that we may be worried about? How can we care for ourselves and keep ourselves around while reducing harm and reducing the harm of the world around us? Recognizing that mindfulness and self-care are important practices to maintain our own well-being, we developed tools and strategies for how individuals can look out for their own mental health, how they can plan to take time to care for themselves, to decompress, and to introduce those daily or maybe weekly practices to help maintain mental health and well-being on an ongoing basis. We developed a tool on self-advocacy in health and social services, reflections that individuals can utilize before going into a medical appointment, insights and tips for how to find your agency when engaging with a service provider, how to handle the moments after if you're regretting something that didn't get addressed, or if an incident took place that was harmful to you and your identity. Dating and relationships are also often a complex space for trans people, resulting in a lot of anxiety and insecurity, and sometimes in unpleasant experience. So we identify recommendations and tips that trans people can put into practice to protect themselves while dating, while acknowledging that the burden of protecting themselves should never be placed on individual trans people, and that in and of itself is a burden that many trans people struggle with. We talked about surviving and coping with street harassment, how to support yourself, what to do in a crisis, how to react or how to get yourself to safety in the event of harassment, and ways to cope in the moments after, how to get the support that you need, or how to ensure that you yourself are processing the negative experiences that some of us live with. Our last two pieces were focused on identifying support systems and creating a crisis plan. So actually helping folks put to paper what to do if the world is indeed falling apart for them, or if their world is falling apart, who to call, when to call, how to notice, what to do when you notice, how to create and execute a crisis plan to help keep yourself safe in contexts where it becomes harder for you to do so for yourself. Now, recognizing that trans folks and faith have a long and complicated history, and that history is in fact itself varied, and that many communities and cultures and religions have had inclusive and diverse ways of thinking about gender and sexuality, we created a resource on trans people and faith. This resource is available both for trans people looking to explore faith and their relationship to it as trans people, and for other individuals who may be struggling because of a faith or religion-based reason with a trans person coming out in their life. And so citations and resources for them to explore on how to process that, how to manage that, all while supporting and including trans people. Recognizing that parents and caregivers are often in a unique context when it comes to having children and young folks come out, and recognizing the very significant connection between supportive parents and positive mental health and reduced rates of suicidality in trans people. We developed instructions or guides on how trans young folks can, how to talk to trans young folks about suicide and about mental health more generally, which is generally a practice we should all explore and put into place, because conversations around mental health and suicidality do not increase risk thereof, but create a relationship where you can actually talk about your experiences, your fears, and your well-being if you are concerned about them. We also talked about accessing community and support for parents. Parents often need folks who they can talk about their kids coming out with, but they need to find those folks without putting the burden on their trans and gender diverse children and young folks. And so we recommended groups and resources that they can access and other tips that they might want to reflect upon so that they can best support their children. We also identified books that are both for parents to process and manage the fact that a young person may be coming out or a family member may be coming out, but also books to help trans and gender diverse young folks feel themselves or see themselves. So they're reflected in the picture books, the middle school books, and the high school books that they're reading or that their parents make available to them. When it came to service providers, we focused on those really core practices of trans and 2S LGBTQ inclusion. Practices, again, like pronouns, tips for how to support trans people, recommendations for creating welcoming and trans inclusive environments, for ensuring privacy and confidentiality for trans people, for building organizational capacity for trans inclusion. So not beginning and ending at a one and done workshop, but taking the time to review our policies and procedures, to undertake targeted and in-depth training, not just on what it means to be trans, but how to support trans people in different kinds of contexts. If you're a housing worker versus a healthcare provider versus a peer supporter, to understand how organizations can actually build their cultures and their practices as a model that their staff will then follow, and how to communicate your commitment to trans people and on trans inclusion. It's one thing to do the work, and it's another to demonstrate to trans people that you've done the work. And there is indeed a long history of many trans folks not having positive experiences accessing health and social services. And so this section was very much focused on helping organizations communicate their commitment to trans inclusion to a wider audience, to address and minimize the anxieties that many trans people have with seeking access to those essential services. In terms of other content, in our appendices, we included a crisis plan for suicide prevention, a self-care plan to better understand and explore how to care for yourself, particularly when it feels difficult to do so. Additional learning lists for providers where they can get more information and build their knowledge. A resource list on transition-related healthcare, so a space that, a resource for service providers where they can better understand what it means for somebody to initiate hormones, what their role is in referral processes for access to what we call top or bottom surgery, or other gender affirming or confirming surgeries, and a list of local resources so that folks know what's available to them in their context and community. Feel like I blew through that faster than I intended. That indeed is our toolkit. It has been an absolute honor for our team to be involved in the development of this resource. I want to give a particular thank you to Alyssa and Rose, two of our team members who took on the bulk of this work and brought everything together in a product that I am very excited to make available to the world around us. And of course, I want to give a big shout out and love to Spectrum. Our team has the honor and privilege of working with a number of 2SLGBTQ community organizations, and they do incredible work. Their work is often under-acknowledged and underappreciated. And all of this work, Spectrum's and ours, is always built on long legacies of trans, gender diverse, and 2SLGBTQ people creating community, creating services, creating and sharing knowledge and evidence. And our fundamental belief is always that communities know their needs best. And so it was a privilege to work with Spectrum to understand the needs of trans folks in your community. And again, create a product that could support many folks and communities from coast to coast to coast.